Do you know that rabies is an infectious disease and is considered as one of the major public health problems? Unfortunately, among the 696 individuals in our Knowledge, Attitudes and Practices or CAP study, only 53% of the participants knew that rabies is an infectious disease, and only 73% considers it as a major health problem. So what does this mean? This means that there is a need for more efforts to increase its awareness during Information, Education and Communication or IEC sessions and in IEC materials. What happens then if people are not aware about its severity? Obviously, people will tend to take it lightly and will not follow the guidelines recommended to prevent it. Do you know what is the main carrier of rabies in the Philippines and how you can get infected by it? You're right! Dogs! This is why one of the best ways identified to prevent rabies is to get your dogs vaccinated against rabies every year. Based on our CAP study, 75% knew that dogs are the main rabies carrier, and majority of the participants knew that it can be transmitted through direct contact, such as bite of an infected animal. How will you know if an animal is infected? Most known signs include foaming at the mouth, followed by an agitated behavior and biting without provocation. What happens then if you get infected? 99% of the time, you die. So how can we prevent it? Well, rabies disease is vaccine preventable, and 90% of the participants knew that. According to the National Rabies Prevention and Control Program Manual of Operations 2019, dogs must be vaccinated annually against rabies, and if you are bitten, wash your hands with soap and water and go to the nearest Animal Bite Treatment Center or ABTC to get proper treatment. Let's talk about vaccinating your dogs. Why do we need to do this? First, it's part of the law. Second, owning a pet is a privilege. Having your dogs vaccinated annually is a sign of you being a responsible pet owner. And lastly, according to our findings on the serological test of 260 pet dogs, it will take approximately 5 years of consistent annual rabies vaccination before the titer level reaches 0.5 IU per ml, known as the protective level. In our study, 21% of dogs consistently vaccinated for 3 years did not reach the protective level of antibodies. Moreover, it was noted that as the number of missed annual vaccination increases, the rabies antibody titer decreases by 0.180 IU per ml. This is proof that pushing for rabies vaccination in dogs for 3 consecutive years only, as stated in the National Rabies Prevention and Control Program, may not be enough to ensure that dogs are sufficiently protected against the rabies virus. Thus, we recommend to enforce yearly vaccination of dogs for straight 5 years and ensure that pet dogs are vaccinated as early as 3 months old. Sadly, our results showed that only 57% of the dogs were consistently vaccinated yearly. 81% of the CAP respondents knew that dogs must be vaccinated as early as 3 months old, but only 72% said that they will have their pets vaccinated yearly. What should be done to increase these numbers? There is a need to strengthen the Anti-Rabies Act and strictly impose responsible pet ownership ordinance in the city. If dog vaccination is fully regulated, vaccine coverage of at least 70% will be achieved in all areas, and the number of possible rabid dogs can decrease. Now let's talk about what happens if you get bitten. What do? Best thing is to wash your wound. Go to the nearest ABTC, then get vaccinated if necessary. Based on our CAP results, majority of the respondents agreed about washing the wound first before going to an ABTC. Thankfully, 75% excluded Tandop as a treatment option. Results also showed positive attitudes towards vaccination. However, 40% said that they will not get vaccinated as long as the dog is alive. There is therefore a need to highlight this issue on every IEC campaign and to ensure patient compliance and vaccination. Every second counts. If an individual is not treated immediately, it can result to death, especially if symptoms have already started. A review on the Animal Bite Registry of Davao City from 2013 to 2018 was done to determine the clinical demographic risks and vaccination compliance profiles of exposed individuals. Majority of the animal bite patients were more than 15 years of age, with almost the same proportion among males and females. 97% of cases were Category 2 bites. Shockingly, we found out that 95% did not complete the recommended 3-dose regimen, with 67% and 74% having only 2 doses for both Category 2 and Category 3 bites, respectively. If you look at vaccination compliance per district, it shows that vaccination compliance rates only ranged from 1 to 17% of the cases. And we found that those who did not complete their vaccination were the ones who had limited knowledge about rabies and had more negative attitudes towards vaccination. So, do we really need to get 3 shots? Comparing the antibody levels among those with complete and incomplete vaccination, there were far more percentage of people with complete vaccination who had sufficient antibody levels, 88.4% for complete and 69.1% for incomplete vaccination. Though results showed that protective antibody levels can already be achieved even with 1 dose of the vaccine, the highest levels were noted with 3 doses or upon completion of the vaccination series for both pre-exposure and post-exposure prophylaxis. These antibodies were still present in protective levels even at 6 years post-vaccinations. These findings emphasize the importance of completing the vaccine series for at least 3 doses to be assured of protection, which can continue even beyond 6 years. What lessons have we learned so far? For dog vaccination, the current recommendations are not enough to protect dogs against rabies. We propose early, starting at 3 months old, and yearly vaccination for 5 years instead of the usual 3 years. For humans, we found that even 1 dose of the vaccine can already provide protection against rabies. However, it is still better to complete the 3 doses because it can give higher protection that can even last for more than 6 years. The CAP results can provide data on knowledge gaps, cultural beliefs, and behavioral patterns that can be used to be able to create a more efficient and cost-effective program to stop and eliminate rabies.